Documentation strategies, general considerations. Although accuracy is foremost in each provider's mind when performing a history and physical examination, speed of documentation is also important. One strategy that ensures both accuracy and speed is the use of drawings. Frequently, healthcare providers use a stick figure to document pulses and deep tendon reflexes, and use an anatomical drawing of the body or a body part to document the size and location of skin lesions, rashes, or wounds. In many institutions, both the stick figures and anatomical drawings of the body are already on the pre-printed forms, whereas in other institutions, the provider must draw each item. The goal is to provide the best picture of the patient's condition, either in written format or with a drawing, in order to serve as a comparison for future assessments. So we have here a stick figure that is used to document DTRs or deep tendon reflexes. 0 for no response, 1 plus, sluggish, 2 plus is expected response, 3 plus is slightly hyperactive, and 4 plus is hyperactive. In the documentation process, it is important to only use standard abbreviations. Institutions will have different policies about the use of abbreviations. One institution may severely restrict the use of abbreviations, especially if it has found that the abbreviations have led to medication or treatment errors. Therefore, each provider should check with her specific institution to determine which abbreviations are acceptable. As a reference, both commonly used abbreviations and symbols can be found in many medical dictionaries. Although abbreviations facilitate the speed of recording, the history, and physical examination, remember that the data and information need to be recorded in such a manner that others reading the write-up can clearly understand the information presented. Although many methods of documentation are available, such as direct computer written reports, each new method provides potentially new concerns. As of April 2003, federal guidelines have been implemented to restrict the sharing of patient information either direct or indirectly. Although data can easily be recorded directly into an institution's computer database, this process places an added responsibility upon the provider that computer screens are not left unattended, where patient data can be seen or reviewed by unauthorized individuals. The new guidelines also regulate with whom a provider can share patient information. In addition, HIPAA regulations require the patient to provide consent for his medication information to be disclosed to other individuals. The challenge for the provider is to write an appropriate record of the history and physical examination using the latest technology available without violating the patient's right to confidentiality. The use of email and faxes to share patient information poses an additional problem. Most institutions advise that a disclaimer be inserted at the bottom of any patient-related communication that indicates that the following information is confidential. For example, if information needs to be shared electronically, the following disclaimer may be used. The information transmitted within this email or in any attached documents is intended solely for the individual or entity to which it is addressed. The information may contain confidential and/or privileged material. If you believe you have received this email in error, please immediately contact the sender and delete the material from your system. Thank you for your attention.